Hi, welcome and thank you for joining us today to hear about a timely health topic affecting our communities. I'm Rebecca Munnerlin with Prisma Health Media Relations. Our media partners are invited to post questions in the Zoom chat, and we'll get to as many as possible at the end. Um, Smoke from wildfires burning in Greenville and Pickens counties is causing poor air quality in parts of the upstate right now. And to help us learn a little bit more about what's going on and the possible impacts, Prisma Health Pediatric Pulmonologist Dr. Stephen Snodgrass, who is Medical Director of Pediatric Pulmonology at Prisma Health Children's Hospital Upstate, joins us today and has advice for families whose children have underlying respiratory illnesses and are at higher risk of being impacted by the smoke. Welcome, Dr. Snodgrass. Thank you for being with us today.
Thank you.
I'm going to pin you here so that you're front and center. And we'll just start with asking how significant a problem is the smoke pollution right now in the upstate?
So I think depending on where you are geographically, it can vary, but I think we've all seen it and are aware of it now over the time it's been going on since last week. And I mean, I would say just given the proximity to all the areas that we're covering here in the upstate, and as it kind of spreads out from there, it's very significant. It's certainly the most significant kind of that I have ever seen before. We were had some involvement or some discussions when there several years ago or some time ago, some wildfires in the Carolinas as well, or Western North Carolinas, and there was some smoke into Greenville. But I think just given the proximity, this is very significant. And when we can all see in downtown, like yesterday, how quickly it changed with wind direction and stuff, this happened in matters of, hours or half hours. That it's going to be unpredictable, I think, while the fire burns. So I think the problem is significant and can, quickly affect people with underlying conditions or anybody. And if people are not taking precautions or aware of that or have some contingency plans, they may get into trouble, and we're trying to avoid that by being proactive and just getting the word out about preparedness and communications with your healthcare providers and healthcare teams and things like that. Based on the calls we're getting in the office, I think we can tell it's already pretty significant. A lot of people are just being proactive and want to have information, but a lot of people maybe are already dealing with some symptoms or asking about activities and outdoor time and things like that.
Tell us a little bit more about who may be most affected by the smoke problem.
Yeah, so certainly in like most things, I mean, we think about, number one, people with underlying chronic conditions in general, whether that be asthma or babies with premature related lung disease or anybody really with a chronic condition that may have some respiratory impact or implications. Certainly, those more vulnerable in general, even healthy young children or babies or the elderly may be more impacted. And even, normal healthy people may be affected, in mild ways, just because if any of us go outside and can smell smoke or, see particulates in the air and just, quickly realize that the air quality is not good, if we're affected or even bother just a little bit, consider that anybody beyond us with a chronic underlying condition or more affected or more vulnerable is going to be even more affected.
Got it. What symptoms should families look for, especially in their small children?
Yeah, I think it's going to be similar to what we see most of the time with acute illnesses, whether they're acute infectious illnesses or other things that come up seasonally. These particulates or poor air quality can cause cough, shortness of breath, chest discomfort, just a general sense when you're outside that, things don't feel good or that you're irritated. Eyes can be irritated, especially with activity, when you're hyperventilating, running, aerobic activities are going to cause more intake of air and, further irritate things. So it's very much, the same symptoms we normally see, but just an awareness of what the triggers are and that potentially that's being specifically exacerbated by smoke. I also think it's important to mention this time of year, the pollen counts are already extremely high. And that was definitely something I was thinking about too, because this is a time of year we get a lot of calls as we move from respiratory season into the spring with pollen and allergicness, that triggers lots of problems and some of these same symptoms. And so, we're dealing with particulates from pollen and high pollen counts and allergic triggers, and now smoke potentially day to day. So it's going to create the scenario for multiple potential triggers to impact people at risk. And again, just awareness of that and the importance of proactivity and regular maintenance in terms of medications and treatments are going to be even that much more important.
If folks really need to be outside, even for short periods of time, do you have any advice for what they can do, or do people mask for this?
Yeah, I mean, I think in general that's a good. I mean, we would limit. I mean, ideally we'd like to limit at time. Limit as possible. Time outside, especially when the air quality is poor. And I would consider that even when the air quality is not potentially poor, there's not an air quality alert or specific notice that still people may be affected or susceptible, or that things can change quickly. I would advise that people just kind of use their judgment or consult with their healthcare providers and families, and think about time outside and what may or may not be crucial, or try to limit it to times when the air quality is a little bit better, or uh, it's a little bit potentially safer. We would not recommend masks across the board, or that if you feel that that's something that you want to consider, to consult with your healthcare provider. Respirators and N95 type masks are going to be potentially the most effective. And so, that can create some issues. You need to have a little bit of knowledge about fit and, who that's best applicable to. And so in that case, I'd really recommend that people, patients, families consult either with their regular healthcare providers or their specialists or their asthma doctors, or their allergy doctors.
That all is really helpful to know. Do you know, and I guess this would just be maybe talking to parents. I was wondering if any of the schools were keeping kids in for recess or
Yeah, I don't have a sense of that yet. I mean, we have definitely sent out a fair amount of excuses already, or at least letters for information or informative or educational purposes. And we're going to be, I think schools and teachers and school nurses should be aware that we will potentially be pretty liberal in excusing some folks, or at least making sure there's allowances for some time indoors rather than recess. Again, on a case by case basis. I don't think we would make blanket statements now, or limit all activities, but certainly school officials and nurses should be aware that folks that are more at risk or vulnerable certainly might be affected, or might be asked or excused to stay indoors, or should have asthma medicines and other medicines readily available for unpredictable symptoms.
Focused a little bit on kids and those who don't necessarily already take treatment for asthma or other breathing conditions, but maybe come home and parents see that they're coughing or hoarse or have some symptoms that tell them that they have been exposed and maybe have some irritation. What do parents do for their kids? Do they need to keep an eye on them for a little while? When should they bring them in?
Yeah, I think, and without underlying conditions, I think monitoring is just kind of the most important. Limiting time outside if that was a trigger, and I think symptoms will alleviate. It's unlikely that healthy individuals will have symptoms that continue to progress or worsen, especially once you're removed from the trigger. But I do think when you're inside or when you're driving, it's important to try to recirculate air if you can. Like when you're driving with the air on, you can recirculate the air to try to prevent ongoing intake. If you're in a particularly smoky area, we'd advise, if possible, if you need air conditioning, to have windows closed and not windows open, because you want to try to be in an area where you're avoiding kind of continual intake or exposures when possible. But I think most healthy people may be affected, but have very transient symptoms with some cough or some irritation or something like you might have on a bad day with allergies. But should recover, but should consult their healthcare providers if they feel like symptoms are escalating or worsening, or not responding to removing yourself from the trigger or irritant.
I was thinking this time of year might be a good time to check your filters in your house and in your
Yeah,
car. When
for
is that
sure.
even? Yeah.
For sure.
Well, does anyone have any other questions they'd like to post? I think we addressed the one I saw come up about whether N95 was a superior mask choice.
Yeah, it is in general, Carol. I mean, it's even what we did for COVID and other things, are not going to filter out some smoke or small particulates. So But again, I mean, these can be hard to fit on children, and I wouldn't recommend across the board. They may be applicable in some scenarios, but I would really, suggest that people touch base with their, healthcare providers or specialists, to make those decisions if they feel like it might be something that would be useful or something they'd like to discuss more.
It sounds like this may be going on for a few days. So, and hopefully it's slowly but surely coming under control. But with this being a prolonged situation, do folks just continue to take those kind of standard?
Yeah, yeah. Yeah, it's going to be unpredictable, I think. And I mean, those of us in Greenville, I think yesterday again saw how quickly this could change. I mean, with wind direction and stuff, I think today and perhaps maybe it looks like for the weekend, wind conditions and directions may be a little bit more favorable for us, and not be blowing down into, Greenville. But again, I think that could change very quickly. And over the parts of the area that we cover and our health system, if one group of isn't affected, another group may be affected. So, I mean, I think that makes it even more important for people to have contingency plans, to have, rescue medicines available and, a sick plan that people use for acute symptoms. They need to kind of have at the ready. I'd also emphasize that people, be in touch with their healthcare providers and have regular refills. It's the regular medicines that they need to stay healthy. And then it's a sick plan or contingency they need to deal with, rapidly changing environmental conditions or traveling somewhere and not anticipating, being in an area where there's exposure or worse conditions. I think that'll be really important.
There are some over-the-counter medications, I think, for asthma symptoms. What are your thoughts on folks seeking that out if they feel like they're really wheezing or
I'm sorry, say that one more time. I'm sorry.
over-the-counter medications for asthma? Do you have thoughts on those?
Yeah, I mean, most asthma medications, quote unquote, are going to be prescription or from healthcare providers, but again, it might be a good idea for patients or parents to revisit, things they've had for a while that haven't used, for example, like our albuterol inhalers and nebulizers and our, first line asthma treatments, if they haven't been used for a while, may need to be updated. Cough and cold medicines, may not be acutely, beneficial or as applicable given the nature of this trigger. So it's really going to be, removing yourself from the environment, prevention, limiting, the exposure, I think, and then with people with prescription medications or known underlying conditions, making sure, again, they're refilling medicines, being consistent with regular standing, ongoing daily plans, and then making sure they have plans to deal with acute symptoms and potentially, sometimes rapidly, changing conditions and maybe unpredictable, flares because of the environment that changes quickly.
Right. So if your child is showing those symptoms, just keep an eye on them, maybe limit their level of activity, keep them
Yes.
in general, just
Yes, and I mean, and if you're concerned, I would advise people, consult their healthcare providers, and there may be, and new, acute interventions even for healthy children to, to consider. But I think again, for the majority of people and children, I mean, removing yourself from the environment and being cautious and just aware of what's around you, and some precautions. I think, even if there's some symptoms, once exposure is gone or you're kind of removed from that environment, I think most of those will resolve.
Thank you. That was so helpful. I don't see any more questions from our participants today. Thank you so much, Dr. Snodgrass, for this good advice to help us kind of know what to do and to be prepared as the wind conditions change and the smoke might be blowing into our area or hopefully alleviating in the next few days. And wishing all our firefighters well out there too, I know they're working hard at their jobs, trying to keep everybody safe. So without any more questions, we'll bid everybody good health and stay safe.